Hello everyone, my name is Dr. Soto. I'm a psychiatrist. Today we're going to be discussing Suboxone. So Suboxone is a combination of two different medications, buprenorphine and naloxone. And the main component here, the most important part of it, is the buprenorphine. Buprenorphine is a partial opioid agonist, which means that it acts on the same receptors in the brain as medications or drugs like fentanyl, methadone, heroin, oxycodone. However, it activates the receptors to a lesser extent. So this is very important because taking buprenorphine, you can reduce withdrawal symptoms and also reduce cravings without the risk of producing an extreme high or an overdose, such as caused by respiratory depression, which, fentanyl, for example, is famous for. The other component, naloxone, is actually an opioid antagonist. And so this works by blocking the opioid receptors. So why would we combine these two? Well, the answer is that when you take naloxone by mouth, it is only absorbed about 1 to 2%. And that 1 to 2% that is absorbed actually is metabolized and changed by your liver to be inactive. And it's there because if someone were to take Suboxone and try and cook it down and inject it, the naloxone would be active and it would block any effects and therefore prevent them from abusing Suboxone. So overall, Suboxone is a very effective medication at reducing withdrawal symptoms, at preventing relapse, and at keeping people engaged in their treatment regimens. There is one thing that I wanted to talk about that is kind of interesting property of Suboxone, specifically buprenorphine. Now, it has such a strong binding affinity for the opioid receptors that it can actually cause something called precipitated withdrawal. Now, if someone comes in and they've been using heroin or fentanyl or methadone, they have that drug in their brain. And if you give the Suboxone too fast, the buprenorphine too fast, because of its high binding affinity, it will go to the opioid receptors and will actually remove the full agonists like heroin, fentanyl, methadone, and it can cause withdrawal symptoms very quickly. So what we do is we wait for people to start experiencing mild to moderate withdrawal symptoms before we start Suboxone. That way, we can not precipitate withdrawal and allow the medication to work best. So, opioid addiction problems, opioid use disorder, is a huge problem in the United States. Suboxone is FDA approved to treat this. It can be a life-saving medication because, in addition, another thing I forgot to mention is that if you have buprenorphine in your system and you go and you take a full agonist like heroin, fentanyl, methadone, because the buprenorphine is there bound to the receptors so tightly, it can prevent those other full agonists from binding to those receptors and can actually prevent overdose. So it can be a life-saving medication. It's a very genius kind of mechanism of action, especially combining it with naloxone to reduce abuse potential. So overall, that's Suboxone. If you found this video interesting, please like it and subscribe or comment. Ask me some questions. I'm going to be posting more medical related content soon. Thank you very much. Once again, this is Dr. Soto and I'm a psychiatrist. Nice to meet you.